A lot of people that we talk to, especially when it comes to cancer, will stress an alkaline diet.
Sure.
Your thoughts on that? Because the thought is that cancer is very acidic, can't live in an alkaline environment.
Sure, and that's the alkaline, acid-alkaline balance is very interesting. It's actually a little bit hard to measure. We can measure pH in a variety of tissues. We can measure it in blood, urine, saliva, but it hasn't gone through the rigor that it really needs to say this is what we should be doing. I'd rather think of it as alkalizing versus acidifying foods because, and this is the tricky part, a lemon is acidic,
Right.
but it's actually an alkalizing food. So make sure that you stick with the alkalizing foods, at least more so than the acidifying foods, and that's a good start. But that's not perfect either. When you do that, when you eat more alkalizing foods versus acidifying foods, you're eating more fiber, you're eating more plant nutrients, and those are the two things that I recommend every cancer patient do more of. Because, and I actually ask this in one of my lectures, I say, who in the audience, physicians, are recommending a vegetarian diet for cancer? And some raise their hand. And I ask the same question again, or a little bit different, how many people recommend a ketogenic diet, which is this high fat, maybe high protein, pretty low carbohydrate diet? And a couple people raise their hand. And I say, you're both right. They both have been shown to be effective in certain instances. The fact is we might have to do a little bit of tinkering around with understanding that person's physiology, that patient selection criteria before jumping headlong into one of those diets.
And I think when you talk about that, you stress the importance of having like a naturopath on your team, because a lot of oncologists, I don't think, will hit the diet aspect of treatment as much, do they?
No, and I don't blame them because it's controversial. I head to a conference that's, controversies in translational medicine and in nutrition. Well, because there is, even down to the nutrient level, like glutamine, a really popular amino acid, been shown in many studies to be helpful for people going through chemotherapy. It's also been shown to potentially stimulate the cancer. So it's like, well, where does it fall? And if I'm a standard medical oncologist, I don't have time to sort through that when I am dealing with toxic drugs, and I need to know right timing, right dose, right duration of that. That's where all my focus is, and if I'm the patient, that's where I want his or her focus to be, rather than, oh yeah, and here's some nutrient stuff as well. But as far as like actual food diet, the same thing goes. There's as many controversies. So if I could get oncologists to hang with me for a day, they would probably come to the conclusion of, you know what, eat as least processed foods as you can and keep it as nutrient dense as possible. And if they just said that, we'd have a lot better results, I think.